Coming up on the live and interactive ACSA legislative lunch break, Edgar and I will get you all of your latest news and information from the state capitol and CDE with an in-depth analysis on how it impacts you. Plus, we are talking about school-based mental health funding. We've got two experts in the field to talk about that program and the resources that you may need in your school district.
The ACSA legislative lunch break starts now.
And it's just after 1 o'clock on a Wednesday. We welcome you to the live and interactive ACSA legislative lunch break, along with Dr. Edgar Zaswata, ACSA's executive director. I'm Naj Ali Khan, ACSA senior director of marketing and communications. Welcome. We're happy to have you back on the show after taking last week off for our governance meetings down in Southern California. Edgar, how are you today?
Good, Naj. Hey, 2 weeks in or 2 shows in a row. I was invited back, so I appreciate that. Hey, it's not a given these days. Now I see what you and the rest of your team there has this whole media platform network now.
It's with an empire.
An empire with various podcasts. I'm waiting for my invitation to some other show besides the lunch break.
One?
Well, maybe I should just be happy that this keeps getting renewed and we're still on here. But I told you I was going to prioritize it. I got some messages that people liked the idea about that. Even if we're on the road, I got to find a way to just carve out Wednesday at 1 p.m. So hey, message understood. I bumped a number of other people for you today.
Oh, that's good. So. That's good. That's good to know. Neri is our first one up on the chat today. Ellen Wheeler and Jared Hungerford. So good to have you guys on the show. As I said over in the open, we're going to be talking about student mental health funding. And I think it's going to be an interesting conversation because there's been so much back and forth between the state and with our school districts. So we're going to talk with experts in the field on that. I do have to ask you, Edgar, because if I remember correctly, you did see Game 2 of the Dodgers Mets series. Is that correct?
Every time I knew, I hear it in your voice when you're going to ask me a question that is a setup question. That is just to give me a hard time. Yes, unfortunately, I took the day off, went to LA to go watch Game 2. Unfortunately, it did not go our way, but it's all right. I'm going to right now. I have low stress level. I made a joke about this last week, but I don't know how much I was joking. I think it was true. I think my blood pressure was at a high most of last week with the Padres series, and I know we had our governance meetings, and I was trying to be focused there, but I was really just stressed out for first pitch. So I'm a big rabid fan, and I love baseball and I love sports. When it comes to this time of the year, I have to question if this is good for my health, but you wouldn't know that because you're a Giants fan and they're not.
Here we go.
And they're not in the playoffs.
So. All right, so now I'm going to give you a hard time, Mr. USC alum, after the Trojans lost to my Nittany Lions on Saturday. I was going to let it go, Edgar, but then you decided to throw in the whole Giants thing. So
I knew that's where I thought you were going when you started asking me about what I was doing.
That's exactly what you were doing right there. You were hanging out with Shohei.
Yes, that's exactly what I don't want to talk about USC either. Not this week.
All right. Folks, like I said, we're going to talk about school mental health funding in just a second. A couple of news headlines for you. And of course, we can start with the news that came out last Thursday, the CDE releasing the 23-24 CASP and LPAC data, which showed measurable improvement in data post-COVID, a sign that the work that's being done in our school communities to support students is certainly working because it's helping to get the students to at least meet or exceed standards in ELA, math, and science. Now, the report has a lot of data, but we did see increases across the board, including with our marginalized and at-risk populations. And Edgar, when the data came out last Thursday, it was good for all of us to be able to review and see that we are seeing some improvements post-COVID.
Yeah, absolutely. And I think it's worth repeating. And it's something that I think every educator in our state will acknowledge, every leader, that, look, the data also shows that we're still below pre-COVID levels in most of the categories and most of the demographic groups. And one, it's worth remembering that nobody thought that the pre-COVID levels of achievement were something that we need to rest on our laurels, or that was something we had a lot of work to do even then, right? Especially for historically disadvantaged students, for those groups that we put so much attention on. So I think it's worth repeating that we all acknowledge that there is and continues to be a lot of work to do. With that said, I think it is good to see some of that, incremental improvement, while also acknowledging that, hey, we're not there yet. And even when we get to those levels of getting where we were before 2020, that there's so much work to do in the state as is nationwide. But I think, like you said, we also want to highlight some of those places, some of those districts. I think what always gets lost in some of these narratives is the individual communities, those districts, those leaders, those educators that have found a way to move the needle. And there's a lot of those examples. I think, frankly, here at ACSA, one of the commitments we're going to make here moving forward is to try to lift those up, to highlight. I know that's something we've heard from our members. Hey, those where the schools, the scores have gone up and they've seen measurable improvement, what are they doing? Where are folks even wanting to learn from those communities? So that's something we're definitely going to dig into.
Yeah, and CDE recognized a few school districts. I want to just name those: Benicia, Compton, Fallbrook Union, Los Angeles, and Santa Maria Unified School Districts, all recognized for their strategies in achieving large gains among multiple groups. And one of our board members, Edgar, you had made note of this on Thursday. Amy Alzina, who's over at Cold Springs Elementary School District, also one of the biggest gains among school districts here in the state. Also want to make note of a really interesting story that's in EdSource. EdSource is doing a series on transitional kindergarten and some of the challenges. This is the fourth piece that appeared today in there. The story's on facilities, and we've talked so much about facilities, Edgar. The challenge of having appropriate classrooms for transitional kindergarten that include restrooms and playground equipment. This is actually holding back several districts in being able to bring in students for transitional kindergarten. The challenge is a number of families are interested, but finding the appropriate facilities means in some neighborhoods, there are not facilities. In other neighborhoods, there's an abundance of space for these transitional kindergarten classes. I'm sure that there are elementary school administrators who are watching our show, or superintendents. And we're interested, very interested to hear about some of the tactics that you're using in your school communities to bring in these TK students. So if you have anything, go ahead and put that into the chat. I know,
Naj, I'll just make the connection on that end, just because you talk school facilities. I know Please. Prop 2 and the facilities bond, something we've talked about here on this program, and we obviously, it's been one of big emphasis as we're coming. Right. I think folks should have their ballots there just to make sure that we are supporting that statewide facilities bond to deal on so many levels of the need that we have across the state.
Yeah, and I know, in the case of the school where my wife is a kindergarten teacher, they have a classroom that is a kindergarten classroom that also serves as a transitional kindergarten classroom. So the facilities are there, but that's not the case in all school districts. So like I said, if you've got anything, any suggestions, anything you guys are doing, go ahead and drop those into the chat. All right, so let's move on to our main topic today, Edgar. In the 21-22 Budget Act, a new statewide multi-payer fee schedule was established as part of the Children and Youth Behavioral Initiative. That established a new billing system for schools and school-based mental health services. Now, ACSA and several education groups have been meeting regularly with the state to address some of the challenges. And we actually have a letter on the ACSA Resource Hub where we note some of the challenges. Those groups, including ACSA, have asked for a legislative hearing that is expected to come in 2025. But last month, California Health and Human Services Secretary Mark Galley responded to our concerns with a 19-page response that addressed the concerns point by point. Part of why we're discussing this today is we wanted to have an open dialogue, talk about some of the successes and challenges with two experts in the field, and see if we're hitting the mark on this. So let's go ahead and introduce them to you. Autumn Boylan is Deputy Director of the California Department of Healthcare Services, and Jose Campos. He is from Yoruba Unified School District, the Director of Parent Involvement and Community Outreach. Jose and Autumn, it's great to have you guys here. Welcome to the ACSA Legislative Lunch Break. Autumn, tell us about your agency, how your agency got involved in the California Youth Behavioral Initiative, which was announced as part of Governor Newsom's Master Plan for Kids' Mental Health. And what projects are you overseeing as part of this program?
Great. Thank you so much for the invitation and introduction. So happy to be here with you all this afternoon. As you mentioned, the 2021-22 Budget Act that was passed as part of the 2021 budget process did establish the Children and Youth Behavioral Health Initiative, including many of the components. CYBHI, as we lovingly call it, is an initiative that actually encompasses over 20 different strategies to improve mental health outcomes for children, youth, and families across the state. And it's a multi-department effort. So it's led by the California Health and Human Services Agency, but the Department of Healthcare Services, where I work, is one of the departments under the agency umbrella that is leading many of the efforts, including a significant share of the school-based services work that we're doing, either through this fee schedule, the Student Behavioral Health Incentive Program, or SBHIP. We are also leading the Wellbeing and Mindfulness Grant Initiative and the grant funding that went out to all 58 county offices of education, CalHope Student Support, and the new work that was just announced last week. Through the Children's Partnership, we have a grant program to implement pilot programs for peer-to-peer programs for high school students in 8 high schools across California. So we're leading quite a bit of the work. We also lead the work related to Saluna and Bright Life Kids, our free mental health services applications that we launched earlier this year that can really be a good supplement to the work that schools are doing to provide care to students and provide that 24/7 support through qualified and trained coaches to really help the infrastructure, help students with their wellness, and make sure that kids are getting access to the care and support that they need when they need it and in a manner that works well for them.
Autumn, Jose, thanks for being here. Thanks for helping us with this conversation. Jose, first of all, I have to know, it looks like you have a bit of a fan club there in the comments. A lot of people giving you shout outs and whatnot. Good
clearly, Jose, our promotion of you being on the show is a big deal over in your school district.
Jose, so in your district, speaking of your district in Jurupa, you guys are involved in a pilot program on this fee schedule that Naj was referring to, alluding to, and Autumn was talking a little bit about. How will this new benefit structure, how will it benefit your district? What can you tell us about it? And also, like, how are things going so far?
Well, first, again, thank you for the invite, for being here in this audience. And I wanted to also just kind of note that part of my role is also all of our behavioral health services and the sustainability of those services. So that way, as I respond, it's going to be in context to that. The pilot program, that's, cohort 1. So the fee schedule, there was a cohort 1, I believe it's 47 county offices of ed and local LEAs that are participating. So these are your outliers in the state of California that said, hey, I want to be part of that pilot. And part of the pilot, Department of Healthcare Services was very clear. This is the learning cohort. In other words, it's going to be messy. We're going to work. We're going to be pushing back with one another as far as, you have healthcare, learning education. You have education, learning healthcare. So we had to really get in the trenches of understanding and learning one another as we looked at what was established, provided feedback, and embraced it. And I think that's like the key as far as how it's going. It started with that pilot. And for us in Jurupa, quite honestly, as you mentioned, this Children Youth Behavioral Health Initiative and when that was launched, I remember presenting to our board a year and a half ago, talking about the universal fee schedule. And at that point, as everything was being commented, this is going to be a game changer, bringing in revenue. And that's exactly how we took on this pilot. This is going to be additional revenue to contribute towards our sustainable services. It'll be additional revenue to add staffing, and more so for us, adding and increasing access. We already had a system where we're providing services for our Medi-Cal recipients. This adds a more sustainable resource for supporting our students and our families with commercial insurance. And to that, back to your point as to how it's going, we have our electronic health record. We've been, ready in February. We're collecting healthcare insurance information from our private insurance, and our families have been ecstatic that this is becoming available to them as far as a service within our school district. And at this point, we're at the administrative piece of just getting to that next phase of, hey, we're ready to now submit for reimbursement. So we honestly are just very blessed to be part of this pilot and fortunate to have had an infrastructure. I like to think we're outliers within the outliers.
I'm glad you said that, Jose, and talked about some of the successes that are taking place in your district. Because Autumn, as I had mentioned earlier, and I know that the education organizations have been working with the state to kind of address some of the challenges that are out there, because there are challenges that are out there with the fee schedule, and ACSA has been very concerned about the collection of health information, ensuring privacy of students. How are you guys addressing these challenges?
Yeah, thank you. I would say that first and foremost, we're addressing these challenges in partnership with county offices of education, local education agencies, and our colleagues from the education sector across the state, like ACSA. We have, since the beginning of the CYBHI initiative, met with a cohort of education colleagues to really get input on the various strategies for implementing this program. And as Jose said, and really much better than I will, that first cohort is really a learning collaborative environment where we dug in with our LEA partners on the issues related to collecting student health insurance information, and brainstormed together about what options exist for us to be able to obtain that information and get schools reimbursed for services to students and minimize the burden of that for local education agencies that are participating. So we looked at what statewide systems might be available to support. We contracted with a third-party administrator who can help school districts with the claims process and really be the ones who are the intermediaries between the school districts and our health plan partners to make sure that schools don't have to navigate all of the various complicated systems and structures of all of the different plans, but really just simplifying that down to a single statewide centralized entity that can have one process for collecting claims data, for collecting student health insurance, for navigating HIPAA and FERPA with the school districts. But this is a complicated program, or I should say a complex program. And we've spent this last year, since January, working through all of these different operational complexities with our partners as they're implementing this, to learn what's going to work, what's not working. We try some things and then we get feedback and go back and change it based on the feedback that we received to make sure that this program works. At the end of the day, there are some things that school districts will have to do to participate in this program. Collecting student health insurance information is one of those things. But what we talked about, with the LEAs that participated in cohort 1 is that to some extent, all school districts collect this information through emergency cards at the beginning of the year. They also can collect that information at the point of service. Mm-hmm. So not necessarily a wholesale systematic approach to collecting health insurance information, but there are ways to do it. Some school districts did collect wholesale systematic student health data in response to the COVID-19 pandemic. And there are different ways that school districts have managed this. And so we are cognizant of the challenge of needing to do that. and trying to mitigate the effect of that in terms of the administrative burden by making, the data points that need to be collected and transmitted, as small as possible. So we're not collecting more than what we actually need and adding to that burden. But there are things that folks will have to do. There's 100 or so health plans in the state of California across all of the payers that are responsible. So not just Medi-Cal, but commercial plans and disability insurers. And we have to be able to match students to all of those health plan systems. So we're thinking about how we continue to make that more accessible, easier, streamlined administratively, while we're also contending with kind of the complexities of intermingling HIPAA and FERPA and making sure that we're building out toolkits and resources to help support school districts in navigating all of these, not just the complex rules around privacy and consent for data sharing and all of those pieces, which we're absolutely doing, but also in terms of just the operational infrastructure for actually submitting a claim and getting reimbursed for services that you're providing to students.
Autumn, let me just ask you a quick follow-up question, because I think you had mentioned that this was kind of a learning process for you, and that in this year has basically been a learning process. And generally speaking, when we talk about our districts out there, we do know that there's an educator shortage. We talked just a moment ago about facility shortage, and there are LEAs out there that don't necessarily have the operational readiness to be able to implement, to be able to take in some of this health information, to be able to work on some of these mental health services. So from your standpoint, just from your lens, what do you say to rural districts that are already, facing other challenges with staffing? How do we make this work in some of our rural districts?
Yeah, thank you. I think that's a question that we're actively exploring right now. Appreciate the question. The California Health and Human Services Agency, my department, the Department of Healthcare Access and Information, and the California Department of Public Health have been going out and meeting with small, rural, and frontier counties to ask exactly those questions. How do we adapt this program to make it work for small, rural, and frontier counties? We went up to Trinity County last month and Tehama County earlier this week. Folks were up in Modoc County talking to folks about how do we make the CYBHI initiative, not just the fee schedule, but all of the programs really work for those districts. And we're trying to be as flexible and mindful as we can in the design of this program to make sure that small and rural school districts can participate. So, for example, while we think it's great what Jose was talking about expanding access to care and hiring new staff, that's not necessary to participate. Every school district in the state, and there's 1,100 of you, is providing some services to students today. And so this is about making sure that schools are getting reimbursed for services that you're already providing to students, and holding our health plans accountable for coverage of services that they're already obligated under state and federal law to provide to their enrolled members. So that's the first thing. The second thing is we're really trying to be as flexible as we can be in terms of implementation models. So we're allowing small and rural school districts to work in a consortium model where the districts are either working under the auspices of the County Office of Education or regionally with other partners, including LEAs or county offices of education from other counties, to be able to manage this infrastructure. We have said and continue to support school districts who are working with billing vendors or other third-party entities to help them manage this work. We are also encouraging school districts to work with community partners, many of whom already have experience with navigating healthcare delivery system reimbursement, are familiar with credentialing policy, can help lift up some of this infrastructure in partnership with the school district. And we've tried to be as expansive as we can be in terms of defining who gets to participate in this program. But we really encourage partnerships, whether it's with other districts, with your county, or with community-based providers that can really help small school districts support and lift up this work.
Naj, I saw in the chat that somebody mentioned it was they were happy boss day. Well, I have two of my bosses. They're asking questions in the chat, so I gotta make sure to get some of the questions from our board members there. I'll get to that in a second. Jose, one question as Adam was talking and Naj was kind of giving the overview. You're tasked with dealing with going out to the community and talking to our parents and school community about all these changes. Just briefly, what successes and challenges have you seen just from that process? And I'll ask you a follow-up.
Well, I think I'll start by just echoing what Autumn said, in the sense that we meet people where they're at, right? First priority is we don't need to build. We need to look at what we already have and then kind of start from there. And so when you look at connecting with the community, it's starting with what you have. These are the positions. This is our multi-tiered system of support and where we're offering supports. And I think that's important. When we go out to the community, we evolve and we develop. And I kind of like sharing with people. I started and I said, hey, I'm overseeing behavioral health. But when you announce my title, it's Director of Parent Involvement and Community Outreach. So our service is always launched when our department first initiated through the development of LCAP funds, being out in the community. It was never intended to provide behavioral health services, but through our outreach and connecting with the community, providing needs assessments and understanding, we worked with all of our partners to bring in those services. And we evolved and worked with our cabinet and our board because the needs weren't being met. And so as we looked at our needs, we looked at all of our stakeholders, our educational partners. It was years ago, it was critical that we needed to develop our systems. And that's why we are where we are. We launched and began that research years ago, and working with the community. So when we have a new initiative, Children Youth Behavioral Health Initiative, we layer it with all of our partners with what already we're providing with the braided funding. Initially, Autumn talked about all the different funding sources and grants and rounds that came out of the Children Youth Behavioral Health Initiative. Likewise in Harupa, we are an exemplar community schools funded district. We have the Wellness Coach Grant. We are school-based mental health supporting and working with our County Office of Education hand in hand, echoing the same message along with them as we are one of their partners in expanding and building, and all of our partner districts that we've worked with and supported. So that communication, it just layers and it builds, as you mentioned earlier, your fan club builds, but then you're out there really supporting the global community, not just your own community, on how this can be leveraged and layered. But I think it's key to note that there's a lot of different braided funding. Let's think back to our ESSER relief funds. What did all districts do? The call out was, how do we support the need and the exemplified need for behavioral health services? We were one district that used ESSER funds to expand and launch, but we sustained them because we had all of our different contract services. So we're able to continue to build on that. And that includes, again, all your educational partners, your school sites, your teachers, your associations, your parents, your students, and your County Office of Ed, and working hand in hand.
Jose, one other question for me, as Dr. Daryl Kemp there notes, our president-elect. He was wondering, I think it's a great question, to what extent has collective bargaining have to been part of this journey? Because that's always behind the scenes, especially for those that are thinking about how this would work. How do our partners involved in this process?
Look, very much so. They're always on the onset of how do you support and how do you build. And when we launched, we had to determine and work with our associations, our collective bargaining. When we added behavioral health, were we going to add it under our classified or our certificated? We worked with our classified. We built job descriptions together. We looked at the licensing requirements and certifications. So those are all the things we work. Our human resources office, right? That's their expertise level. And then they're working with our collective bargaining, and we're providing that input and that feedback and that support. And ultimately, it's adding unit members. It's adding to just our internal development. It's building that human capital internally. And that's where it's supported us. It's just by continuously building our human capital.
Autumn, let me ask you this question. This comes from Parveen Ahmadi, our superintendent over at Castro Valley Unified. She asked, could you please say a few words about the capacity grant that county offices received to pass along to districts? And the second part of the question I would ask is, as you guys have gone through this process, is there something that you wish you had kind of done differently, or maybe did something that I don't know, kind of change the order of which things went with this?
Oh man, I think that that's a tough question, because I think that there are so many things that we could have done differently, or slowed down, or been, we tried to be very thoughtful. We started with listening sessions. Initially, we had a fee schedule work group that convened cross-sector partners for a year to talk about, kind of what it would take to stand up this program. We met with many different folks, and, it's really all about relationship building and getting to know each other. And kind of what we've tried to do is be humble and really understand what we don't know. But sure, are there things that we could have done differently? I'm sure. But I don't have a hot tub time machine to go back in time. I will say that in terms of the capacity grants and the way that we structured those grants, to go through the county offices of education, the idea is that a majority, not just a majority, but a significant majority of the funding is supposed to go down to the districts. But having the county offices of education assist with the dissemination of those dollars so that decisions could be made at a local level seemed like it made a lot of sense to us. And having the county offices of education supporting this work, being in a better position than we certainly are at the state level to support the work at a local level, to think through how we can implement this fee schedule initiative and use the grant dollars to support that, was kind of the strategy that we were going for. There's an allocation for each county office of education, with a sub allocation for the LEAs in each county, to make sure that the dollars are going down to the districts, and a majority of the grant funding has to be used to stand up the fee schedule infrastructure. So there are some other things that folks could use the funding for. And if you're a district that already has a lot of infrastructure, maybe you get less money than a district that doesn't have any infrastructure and needs more support to be able to stand up this program. But overall, 70% of the grant funding has to be used to support fee schedule program implementation. And we thought it was best for counties and districts to work together to figure out what is the best strategy, than for the state to come in without being even in the education space and saying, okay, this is how much you get and how much you get. And but we wrote the guidance, and we had some parameters, and we worked closely with the Sacramento County Office of Education and the Santa Clara County Office of Education to disseminate those dollars, to get the funding out, and to make sure that training and support are being provided to both the COAs and districts across the state as they utilize those funds to support their fee schedule implementation efforts.
Autumn, Jose, again, thank you for helping us with this conversation today. Obviously, you're coming to this issue from your distinct perspectives, both from the systemic level. Jose, actually trying to put this in place and working with your schools and your community. One final question, and I'll kind of piggyback on Tracy. There's a question asking for toolkits, best practices. Maybe I'll adapt that question. I'll start with you, Jose. Any takeaways or best practices, or something that you would want to leave with our audience as they may be on their individual journey and trying to think about how to move forward on this? Any takeaways that you would offer?
Well, quite honestly, as part of the cohort, the requirement was that you're participating in their developed learning toolkit. So they would have sessions with handouts and video recordings. internally, we've developed toolkits, and as I've shared, and working with the County Office of Education, strong team there where we kind of share, what does it mean to do this? Because there are requirements, and kind of guiding and supporting and having professional learning networks that we do with other districts to guide them. So I encourage school districts and county offices of ed to look at what's been provided and how to promote and provide professional learning networks, and just that room for growth and development.
Thank you. Autumn, final thoughts, anything you would like to leave with our folks in terms of resources or ways to move forward?
Yeah, great. I mean, we're developing a ton of resources, and that's part of what's coming out of this Cohort 1 learning. Cohort 2 kicked off in August. So there's learnings there, but we're taking some of what we did with Cohort 1, turning that into recorded training sessions. We're finalizing an update to the guidance document. We initially put out guidance in February, but we've learned a lot. So we're updating the guidance, finalizing that. We'll be getting that out. It'll include much of what was included in that 19-page letter from Dr. Galley, and among other topics and kind of our learnings from the cohort. We're thinking about infographics, so we can pull out some specific topics we know are of importance and consideration for how this work gets done. California Health and Human Services Agency is working with an organization to provide a toolkit around HIPAA FERPA intersections. We have videos. We're working with county offices and LEAs to create some parent and caregiver facing resources to explain what this program is and why school districts might be asking for health insurance data. So we're creating some parent and family facing resources as well. So lots more coming in terms of resources to help support school districts to do this critical work. And we really do look forward to having all 1,100 LEAs participating in the near future.
That's great. Autumn Boylan is the Deputy Director of the California Department of Healthcare Services. Jose Campos from Urupa Unified School District, the Director of Parent Involvement and Community Outreach. And Jose, let Ofer Adams and Monty Owens, who are calling up on the comment section, they're very excited that you're here today. Autumn and Jose, thanks so much for being with us today here on the ACSA Legislative Lunch Break.
Thank you for having us.
Thank you.
Folks, want to tell you a couple of things. First off, the ACSA Podcast Network. If you are interested in listening to any of our 3 podcasts, you want to be part of the ACSA Podcast Network, our ACSA Leadership Classroom, Beyond the Bills with Ivan Carrillo, and of course, the ACSA Legislative Lunch Break. You can get all of those as part of our ACSA Podcast Network. And of course, if you like what you've seen here on the ACSA Legislative Lunch Break, we want to invite you to like us on Facebook and subscribe to us on YouTube. When you do, you will get instant alerts when we're about to come on with breaking news. And of course, a reminder about our regularly scheduled Wednesday broadcasts. And if you have great stories happening in your school community, we want to tell those stories as well. Go ahead and send your photos, your talking points, and your news releases to our EdCal editor, Michelle Carl, at mcarl@axa.org. We are well past, Edgar, the bottom of the hour here. So
making up for all those lunches we missed, right? We have, when you don't have for lunch with your friends for a while, you want to extend that time a little bit. So
that's a great way. That's a great way to summarize it. Lunch with your friends. When you miss it, we're always here. Folks, thanks so much for joining us here on the ACSA Legislative Lunch Break. Remember, we are live interactive Wednesdays here on ACSA Facebook and ACSA YouTube. Have a great rest of the day and rest of the week, and we'll see you next time.